Joining us now is Executive Director, Health Emergency Initiative, Pascal ACHUNINE. Good morning and thank you for joining us on TVC Breakfast.
Thank you.
Now, government has had concerns when it comes to people taking responsibility, the number of testing, because at some point it said that most states are not driving the testing of persons. And so that seemingly is affecting the numbers we are seeing. And then we now have international travel, inbound passengers coming into Nigeria, a lot of them complaining about how cumbersome it is to do the test, and how the fact that some of the tests are not even credible. How much of a concern is this for you, and where does this leave us as a country, its implications?
So the guidelines have been, first we would be, it's heartwarming to say that less than 120 people tested positive based on NCDC current figures, which means that there's been significant improvement in the fight against COVID-19. Maybe our environment has supported that greatly. But looking at now the economy is reopening, international flight has begun, and as at the last check, over 27,000 people flew into Nigeria.
Right.
The frustration is real. I personally got a call from a family friend in Manchester that I paid, and she had issues with the portal. The 38,000 went, and she had to pay again. And there is no effective structure that guarantees refund, that guarantees how people would escalate such issues and challenges. So right now, and there have also been the case of racketeering, issuance of fake COVID-19 status. And that's sometimes this from the same lab, you get negative, and later you get a text message or an email that is positive.
And that's a concern, because how do we effectively fight this disease that has ravaged our daily life?
Yeah, it is a great concern, more because the economy is opening up now. Schools are resuming next week, and more international travels will happen, certainly. So it rests squarely on the stakeholders that manage this, NCDC, Presidential Task Force, and the Federal Ministry, because one key area is that you must send a signal that as a lab, whether a private lab, especially they have been saying that such have been associated with private labs. So when there is a case of non-compliance or breach, you set an example, you sanction. So when you sanction as Federal Minister of Health or State Minister, as the case may be, it will be a deterrent that because it undermines our integrity, it undermines our sovereignty.
So what is the implication now on, because we are looking at flattening the curve?
Yeah. Yes.
So are you saying that there are chances of we having a second wave with the way things are going?
It is not very certain because of the tropical climate. It's not very certain, especially as we are going into the dry season. It's most likely that will also support the fight. But it is also not something that we should leave to chances, because currently, between March and until as now, there has been effective collaboration between the institutions involved. So if the schools open where children can play, mix, mingle, some of the children are even coming from abroad with their parents. So the one key thing that must happen is enforcement.
All right. Enforcement
is critical, and it is at the state, federal, and every level.
Okay. In all of this now, from March we have been fighting this virus. Over 50,000 active cases, over 50,000 recoveries so far, and over 500,000 tests done. How would you rate us?
We have fared well as a country to the extent that the fatalities is less than 1,500. But I also want to commend the government. I want to applaud the move that was made this week to introduce sanitary inspectors, emergency health volunteers. But that is just one part of it. It cannot effectively deal with when schools resume, especially public schools. And most of the schools that you have seen open are private schools. Yeah. So there is a strong need to collaborate further. The template that we use when polio was fought to a standstill and we overcame polio, we need to drive it further. One, more laboratories need to be licensed.
But from the look of things, talking about licensing laboratories, now we know that there were some that were licensed to carry out the testing of those inbound passengers.
Yeah. Yes.
And we are seeing the discrepancies, and we are seeing that it's seeming that we do not have that capacity.
So the institutions that license should also put effective framework for monitoring and evaluation. If that is not in place, you cannot effectively fight it. This is about our health, and it means that any report coming from Nigeria, people abroad will question it. So that monitoring is critical. And even though we have had gaps, that does not stop us from expanding the number of laboratories that should attend to victims, conduct tests. But secondly, I also expect that the corporate and private sector should step up, adopting public schools. We need to adopt, most of those schools don't have functional toilets. They don't have the taps. They don't have boreholes as it
they
were.
don't
So
have water.
that is critical in making this real, because if there is peradventure there is a second wave, it will be catastrophic, especially when it concerns
adopting
children.
public schools, we have a lot of students in public institutions in Nigeria, public primary schools and secondary schools. Is providing water sanitizers enough to curtail or flatten the curve in schools? Yes,
significantly, because there are safety requirements or protocols. So if a student does not even have a place they can wash their hand in the first place, that's a very critical one in fighting it. Of course, also that adopting includes providing nose masks, providing face shield, because 80% of parents whose children are in public school cannot afford all this.
And some of them, from the divergent views we recorded, do not even see reasons why they should wash their hands.
So enlightenment is also critical, and further engagement. So if we have engaged over time, so there are various non-state actors that can work in driving this. And there must be also a handshake with critical social actors that, like our organization, Health Emergency Initiative, we got opportunity. Many came to us to provide PPE, ensuring that it got to those who needed it. So that handshake is critical.
Pascal ACHUNINE, we hope that we'll still continue seeing handshakes with the government with regards to addressing this issue. Thank you for your time on the program.